Global Perspectives on Digital Health podcast at Health. Massive thanks to Pete and the Talking Health Tech team who have provided equipment, sound, lighting, everything. We love you. We appreciate you. Thank you. So, health. I've been keen to find people who are creating impact in the global health in Europe. And thankfully, I have found people with amazing insights to share. So we've got Guy Parsons from Mission Critical Care. So really excited to be able to talk to you. Thank you for joining us.
Oh, it's fantastic to be here. Thanks so much for inviting me on. I think you're right. It's great to hear about all the exciting things that are happening here in Europe. And Health Europe is a great stage for all that. And I want to take nothing away from it. But what we do need more of, I think, is a little bit more perspective on what's going on in the rest of the world. Because there's plenty of need and opportunity out there to make a difference in health tech.
So Guy, okay, tell us a little bit about the context you're working in.
Yeah, of course. So I'm a clinician by background. I trained in intensive care in the UK. But gosh, my eyes were opened when I went to South Africa and Malawi and realized quite how different healthcare operates in other parts of the world. And what took me there originally was actually my wife's work. She's doing research out in Malawi. And through connections that I made there on the ground, I got an insight into actually how healthcare works for the vast proportion of the world that healthcare doesn't currently serve. So that's what I've tried to make a difference for. And I work currently now with healthcare organizations and with governments to try and understand how we can make healthcare better for a really neglected part of the world, really.
Yeah.
And what we can do with technology to really make gains in that space.
Can you kind of give us some examples of like what some of the challenges are at the front line? And like, are there some kind of digital solutions that are or are not working so well there?
Yeah, I think personal experience, I tend to kind of ground on that. So what I would say is I know in Malawi, school-age kid who for years has been struggling with schoolwork, and his teachers are doing all they can. They're trying to bring him closer to the front of the class. The reason he's struggling is he can't see very well, and he can't see very well because he has a condition called keratoconus, and that's a gradual deformation of the eye that affects your vision. No one knew. He wasn't picked up by any kind of screening. There's no easily accessible ophthalmology service in Malawi. The cost is prohibitive. So he's just been getting harder and harder time at school, struggling, and that's affecting his future. That'll affect his economic prospects. He's, in a position now where he's really suffering, and there's very little that can be done. Now, keratoconus is a completely treatable problem. If it's picked up early, people can have nearly normal vision. But that system isn't there to pick these cases up and get people the treatment they need early enough. So, but there are solutions in the Western world and in the States that can work on that side of things. I mean, we have, just with smartphones, we have the ability to scan people's eyes, figure out what's going on, get them into a care pathway that gets them the care that they need. What we need to do is apply those systems into the African market so that they actually start serving the people who could benefit from them. Because at the moment, very few people are.
As you're saying that, sometimes we get really excited about, there's this like great opportunity for digital health in low middle income countries. We can improve access to care with we can find more of these conditions, etc. with this tool. But actually the digital infrastructure is not there, which we've talked a lot about on the podcast, but also the actual medication that could treat that are also not there. So what good is finding this if we don't have all the other things around it that actually allow us to achieve the health goal that we're trying to achieve? So if we extend this story for this boy, kind of what, is there a happy ending there, or does a lot still need to be done so that he can actually then not have to be at the front of the class and succeed in school and succeed in his life?
Yeah, you are so right. Copy pasting point solutions doesn't work. You need to look at the whole system. And at the moment, unfortunately, there's no happy outcome. There are medications and treatments that can be provided to that person, but they're not easily available currently. So you're right. Just picking up the problem isn't enough. And we need to look at the whole system. We need to look at how we train people to work with these tools, how those tools integrate in clinical pathways, how hospitals organize their resources around digital technologies, and how they are supported and invested in by governments and NGOs so that these things are sustainable. It's no use bringing in the latest, greatest thing from Germany or California, putting it in a country and just expecting it to work. That never works. What we need to do is build healthcare systems around these innovations so that they're part and parcel of the solution.
And you've talked about the work that you've been doing to kind of bridge that.
Yeah.
What insights can you share? Can you give us an example of some of the things that, I don't know, like maybe a donor came in with a bunch of assumptions and you were like, hold your horses, to quote the Mandalorian, like, this is the way, right? So how are you showing them the way?
Of the reference. Yeah, I think that does happen. What I would really love to do long term is make my job obsolete. And the reason for that is the way I see this kind of innovation, these kinds of technologies taking off and lasting is when there's real local ownership and engagement with that solution. So for me, it's about building the capacity, building the literacy, building the interest in how people who work in that system are from that place can own the solution to it. And so that's about, the right partnerships. It's about investing in people. And I think that's so often overlooked by donors is they think, well, we've got the money is the solution. I'm like, the money is part of the solution, but where's the money going? Who's using it? And why? Why do you want people to use this? You have to make it compelling for the people there, and addressing their needs. That's the way forward.
Yeah, absolutely on the money there. And it's great because at the moment everyone's talking about local ownership, local leadership, and I think you've summed that up really well.
I could give you just a little example,
please. Yeah.
So in Blantyre, in Malawi, one of the major cities, we know that the future of healthcare is going to be powered by the younger population coming through medical training, coming through laboratory training and other clinical services. What we needed to do was give them some kind of facility where they could engage with each other, learn from the resources that are available, and create the future that works for them. So the Wellcome Trust and other partners invested in creating a facility in Blantyre called the Creator Building. It's an amazing multi-million-pound facility that gives them that opportunity. It creates the circumstances where people can interact, can engage, and you get local ownership of ideas that then people are invested in making into solutions. I think sometimes, and coming from a kind of a digital enthusiast background, sometimes the solution isn't data.
Yeah.
Sometimes the solution isn't IT infrastructure. Sometimes it's giving people bricks and mortar for a room where they can have their voice heard.
Yeah.
Because they have a voice and they see these problems firsthand.
Yeah.
What we need to do is more listening.
100%. Yeah. I feel like taking a step back again as an industry and going back to the system level transformation and changes that we're trying to create. And of course there's a role for AI and LLMs and all of that. But what you've pointed out is an innovation in the way we approach something. That's awesome. Yeah. Have you got any last guys, great tips for people building in this space and implementing in and with underserved communities?
I think go in humble. If you're seeing the problem and you want to work on the solution, ask as many questions as you can, because you need to challenge your own assumptions and you need to challenge traditional ways of doing things. I think the best thing that you can do is take a resilient enthusiasm.
Nice.
Because without that, you won't make any progress.
Guy, I feel like we've only scratched the surface of the insights you could give. So will you join us on an episode where we can get into that?
Yeah, I'd love to.
Super. Thank you for joining us at Health on the Global Perspectives on Digital Health podcast.
Thank you so much.
Thank you.